So hello and welcome to the annual International Holocaust Remembrance Day lecture at the CU Center for Bioethics and Humanities. Thank you for making the time to join us as we consider why this tragic legacy is so important for health professionals, both now and in the future. Himber, the outreach manager for the center, and this program is part of the Holocaust, Genocide, and Contemporary Bioethics program, which aims to promote education, scholarship, and community engagement on the lessons of the Holocaust for healthcare and society. Today's lecture will be followed by a panel discussion on opportunities in teaching the legacy of the Holocaust in the health professions. So we hope you'll stay to meet our panelists who represent a wide range of experts and interdisciplinary perspectives. Today's lecture is one of two main programs that we produce annually on the Holocaust in medicine. I invite you to date for our next program, which will run from April 25th to April 27th in recognition of the Days of Remembrance. This year's theme is health equity, with keynote speaker, Dr. Aletha Maybank, the first Chief Equity Officer of the AMA. We are also pleased to announce the launch of a new initiative this year, the Helen Morris American Jewish Experience in Medicine program. The inaugural event will be March 14th from noon to 1:30 on Legacy of the American Jewish Health Community, Colorado's leading role in treating tuberculosis, with Dr. Jeannie Abrams, Dr. Tom Noel, and Dr. Charles Daly. We'd like to thank Dr. Bill Silvers, who created the Holocaust, Genocide, and Contemporary Bioethics Endowment Fund, all of our panelists and speakers, David Weil and Utibe Etta at the center, and the advisory group for all their hard work in planning and promoting today's events. A special thank you as well to all of the health profession students in the audience today. We highly encourage you to share your thoughts and questions with us. This program is being recorded and it will be posted to our website. Please use the Q&A button to submit questions. We will not be able to answer all of your questions, but we do record and share them with our speakers. And a final note of caution. The presentation you're about to see is intended for audiences and contains images and depictions and descriptions of acts of genocide and other human rights violations. I'll now hand the program over to Dr. Bill Silvers, who will be introducing our featured presenter. In addition to being one of the founders and funders of the Holocaust, Genocide, and Contemporary Bioethics program, the accomplished Dr. Silvers is a clinical professor at the University of Colorado School of Medicine and a faculty affiliate at the CU Center for Bioethics and Humanities. Thank you, Dr. Silvers.
I thank you, Malaya. And I thank you for your dedicated talents for the Holocaust, Genocide, Contemporary Bioethics program. The University of Colorado has become a leader in the teaching of Holocaust, Genocide, Bioethics since Matt Renny became director of its Center for Bioethics and Humanities. Matt has worked with the senior historian at the U.S. Holocaust Memorial Museum to develop teaching materials on the legacy of health professionals' involvement in the Holocaust. Dr. Renny is a full professor in the School of Medicine and the Colorado School of Public Health. He's a past president of the American Society of Bioethics and Humanities and has served in various roles in the American Public Health Association, the Institute of Medicine, the Joint Commission, the Hastings Center, the American Board of Medical Specialties, federal agencies, and more. He has published more than 200 articles, chapters, and essays. More recently, he is the author of one of the 10 most read perspectives in 2021 by the National Academy of Medicine, where he and his co-authors wrote Duty to Plan, Healthcare, Crisis Standards of Care, and Novel Coronavirus SARS-CoV-2, perhaps in part drawing from his study and sensitivity to the ethics and the lack thereof during the Holocaust. He has become an influential thought leader in pandemic ethics of today. He's also co-author with Tessa Schluss of Israel of the 6th most read article in the AMA Journal of Ethics, Why Does Medical Participation in the Holocaust still matter, attesting to its relevance today. In this January 2021 issue, Legacies of the Holocaust in Healthcare, we have a paper, A Call to Commemorate International Holocaust Remembrance Day, January 27th, in all health science schools. January 27th, the liberation of Auschwitz. My parents were deported to Auschwitz and separated there in August 1944. Surviving independently, my mother was sent on a Todes march from Auschwitz at 2 o'clock in the morning on January 19th, 1 week before its liberation, later freed in Germany. While I inherited the Holocaust and feel a responsibility to transmit its lessons, its legacy to our and future generations, Matt relates from the ethos of a non-Jewish physician, feeling and stating that there is no aspect of modern medical ethics that has not been affected by the Holocaust, from beginning of life to the end. I thank Matt and all those committed to this mission with him. It's an honor and a privilege to work with and to introduce Dr. Matthew KWhittier. Thank you.
Oh, thank you. Thank you so much, Bill. Dr. Patricia HaberRice, who's my great friend and colleague at the Holocaust Memorial Museum in Washington, D.C., often starts her version of this talk by saying, this is a story about medicine, specifically about medicine mishandled as state policy under a notorious dictatorship. I agree with her. And also, this is a story about what it means to be a health professional, then, now, and in the future. It's the story of how we came to be where we are today. It's a story that can provide illumination for the path ahead, though only if we can figure out how to use it. This is our story. And despite its importance, Patricia also often says the history of medical crimes under Nazism are understudied and often oversimplified. And I think there's a reason for that. It's because it's comforting to think that health professionals are always a force for healing. The traditional ethics of our professions are, nurses, physicians, dentists, pharmacists. We are all beneficent healers. We cure sometimes, we relieve often, we comfort always. And it is comforting to think that our ethics are timeless, that they're immutable, that they are natural to our work, that the values that underpin the work of caring for sick and vulnerable people are stable and enduring since the time of Hippocrates. But these core values were profoundly shaken in the 1930s and 40s when medical professionals took leadership roles in the National Socialist regime in Germany. Physicians, nurses, dentists, pharmacists, administrators, researchers, all not only participated, not only were complicit, not only collaborated, they often developed and led some of the most terrible crimes of the Nazi era. Following the war, a very few were prosecuted, some at the medical trial at Nuremberg pictured here. Most were never held to account. And yet their actions profoundly influence every aspect of the ethics of healthcare today. As Bill just alluded to, really, I defy you to think of a modern ethical dilemma that is not in some way colored by this history, whether it's ethical issues in genetics or racism and health equity, or issues at the beginning and end of life, or cost control, or the ethics of wartime or disaster triage. All of these issues are viewed through the lens of the medical crimes of the Holocaust, even when we don't realize it. So rather than telling you how this story affects health professional ethics today, I'm going to just tell the story. You will see the connections, you'll see the echoes. And then I'll end with some reflections on some of the core challenges that face health professionals in every age, then, now, and in the future. because it's these challenges that can be illuminated through knowledge of this story. Even though that doesn't make their answers easy, it actually makes their answers more complex. First, though, this slide is blank intentionally because I want to say something directly to you before I start, which is I give this talk every year. It is the most difficult talk I give. I give a lot of talks about controversial issues. I like to say that if it's not controversial, it's not ethics. But this talk is different in two ways, one personal and one professional. Personally, many of you give lectures, you know that any topic you choose, you could give a talk and someone in the audience will know the material better than you do. That's always a possibility. But with this topic, there are people, including some listening right now, who own this history in ways that I never will, because I'm not Jewish. I'm also not German. So I have no direct familial connection to this history. And yet, if there is one thing I've learned from my work with the museum, it's that obligations of remembrance fall to all of us. This is our shared history. It's not only Jewish history. We all bear the burden of this legacy, and we have to bear that burden to have any hope of learning from it. And that raises the second way this talk is challenging, which is professionally, it is very difficult to take any contemporary lessons from this history. If I say anything, in the next few minutes that in any way helps people understand how Nazi doctors came to do what they did, it might seem like I'm excusing them or rationalizing what they did. And worse, if I make any direct comparisons between what Nazi doctors did and some contemporary ethical issue, I will be accused of playing the Nazi card, and that will close minds rather than opening them. And by the way, there is truth to those critiques, right? As shocking as any modern breach of research ethics might be, there is nothing going on today that comes close to intentionally infecting a young girl with typhus, and then when she dies, killing her healthy twin so you can dissect them both and compare their organs. There is no critique that we could level against any research today that is like that. It pales in comparison, right? And yet, as difficult as it is to learn from this history, somehow we have to learn. So I'm gonna ask you all to start with your minds open to the possibility of learning from your profession's role in these heinous crimes. And to recognize that because it was so heinous, the history of health professionals in the Holocaust is very prone to oversimplifications, to heroes and villains, making caricatures of complex human beings. But it is exactly those oversimplifications that can divert our lessons learned and subvert our vigilance. So the question in the title of this talk was, how did healers become killers? And I want to warn you, as we seek an answer to that question, it will almost inevitably lead some of you to an extremely disturbing thought. We will, of course, never know what might have happened if health professionals had not taken on the leading roles they did in the Nazi regime. But it is plausible to think without our professional involvement, the Holocaust itself might never have happened. I know that sounds like an outlandish claim, and certainly Hitler did not need doctors to become virulently anti-Semitic, of course. But I'm not the first to think this. This is Dr. Andrew McAfee in 1946 during the Nuremberg medical trial. We'll come back to him later in the story, but the point here is the idea that Hitler could not have carried out his plans without the health sciences community behind him is not as outlandish as you might hope. And that's partly because the story of how healers became killers doesn't start with Hitler. And it doesn't end with Mengele or with the Nuremberg medical trial. In fact, I'm not going to mention Mengele again in telling this story. And I won't say much about unethical Nazi medical experiments, which are probably the part of this story you're most likely to have heard most about. And there's a reason for this, which I'll say more about in a moment. But in short, Mengele and the others who conducted experiments at Auschwitz and elsewhere were often, as Dr. HaberRice sometimes puts it, criminals of opportunity. They wanted to do experiments. They had human beings in front of them. They could experiment in whatever way they wanted with no apparent risk of consequence. But as evil as their actions were, the doctors who carried out experiments were not, by and large, the leaders who created the conditions in which they could carry out those crimes. It was many other professionals who did that. And it's their story I want to tell, in part because their story starts long before the Holocaust and because it extends right up until today. In fact, we really have to start this story far back, at least as far back as Plato, who spoke about encouraging strong young people to reproduce and discouraging people deemed inferior from having children. He talked about taking anyone born defective and disposing of them secretly. He wrote about preserving the purity of a breed of human beings. Essentially, he's describing here what would later come to be called eugenics, which is, in its really easy to understand essence, the notion that if you can breed a bigger ox or a faster horse, you can do the same to produce a better human being. And if you do that enough, you can create a better race. So that is to say, the core ideas of eugenics are those of selective breeding. They were most famously laid out by Francis Galton, cousin of Charles Darwin, following publication of Darwin's On the Origin of Species in 1859. But Galton's thinking really coincided with a number of other streams. There was the rediscovery of Mendelian genetics, which of course today we see as a highly simplified understanding of genetics, but it was cutting edge at the time. And also with an emerging understanding of cells and chromosomes and bacteria, the rapidly emerging science of epidemiology and statistics. These confluent events really created a perfect storm around what was sometimes called social Darwinism during the progressive era in medicine and public health in the early part of the last century. And these came together to really spark this interest in eugenics, which is often thought of as having these two branches: positive eugenics, defining who's valuable, encouraging them to live healthy lives and to reproduce; negative eugenics, defining those who are not valuable, those who cost more than they produce, those who present a threat to the purity of the guardian's breed, as Plato put it. These are people to be marginalized, to discourage or prevent from reproducing, or even worse. Eugenics was not a Nazi invention. In fact, Germans were not really the main leaders in the field. Many were English and American. So Karl Pearson, for example, the namesake of the Pearson chi-square test, inventor of the p-value, and much more, really a polymath. He was an Englishman who believed in effect that genetics was destiny. And he argued as a result that there was no good trying to lift people out of disadvantage because the next generation would go back to their disadvantaged state. And in this pair of very influential books, The Grammar of Science, by the way, was the first book assigned as reading by Albert Einstein when he started his Olympia Academy in 1902. Pearson argues here that stronger races must conquer weaker ones. And note on the right, by the way, the idea of a so-called Aryan race and the idea that it's a superior race is already established in 1901. Adolf Hitler in 1901 was 12 years old. The first International Eugenics Conference takes place in 1912. And yes, it does include a couple future Nazis, but I'll bet if you recognize some of the names on this list, they probably aren't Germans. They're names like William Osler or Charles Davenport or Alexander Graham Bell. The minutes of this first meeting in London are remarkable. This is Alfred Punnett, who is now famous for Punnett Squares, but he presented on feeble-mindedness and said if only feeble-minded people could be prevented from having children, within a few generations, there would be no more feeble-minded people. There were American conferences that were very similar, also held, which drew medical and social luminaries like Harry Laughlin, who's of particular note here because he would go on to write a model law promoting the forcible sterilization of people on eugenic grounds. But I also note Booker T. Washington as an indication of just how appealing the theories of eugenics were. It was, as my friend Paul Wolpe puts it, an elegant theory because it was producing plausible, intuitive answers for many issues, social and medical. I found this booklet at a used bookstore a few years back. In 1913, it was apparently possible to call up the AMA or a state medical society and to ask for a speaker to come out to your local meeting. And many of these speakers focused their talks on racial hygiene or eugenics. I picked this page only because it shows Colorado. And in Colorado, a Dr. Corwin was willing to speak on how eugenics would save society from feeble and degenerate stock. The US was a leader in defining races and acting as though those categories had scientific meaning and implementing those meanings into public policy. These were fundamentally driven by eugenic thinking. The quintessential example is perhaps the one-drop rule for defining who was Black, which was used in then what were called anti-miscegenation, anti-race mixing laws that were to prevent Black and white Americans from marrying each other. Before World War II, before the Nazi era, these anti-miscegenation laws were in all the states. They're in red or yellow on this map. And in fact, when the Nazis came to power, they studied the American use of race in social policy. But the Nazis decided a one-drop rule was too extreme. The 1935 Nuremberg race laws, which were to define who would count as Jewish and prevented Jewish people from marrying Aryan people, required that a person have 3 Jewish grandparents to qualify as being Jewish. Another, even more important perhaps, American eugenics law had a very powerful impact in Germany and a direct influence on Nazi medical and public health policies. In the US, laws promoting forcible sterilization were in place in most states by the 1930s. By the way, Colorado is listed here as not having a law. That doesn't mean sterilizations weren't carried out extra legally here. We know of at least one very well-documented case of forcible sterilization in Colorado. And like the racism and the ableism that inspired these laws, they didn't all disappear after World War II, though they did tend to target more and more marginalized women of color after the war. But North Carolina's law was on the books until 2003. West Virginia's was in place until 2013. Oregon, my home state, carried out its last forcible sterilization in 1981, the year before I graduated high school. These laws in the US had made their way through the courts. The first, the Indiana law, passed in 1908, was passed, repealed, refined, re-implemented several times with different due process provisions attending. And they were eventually supported by the US Supreme Court in the infamous case of Buck versus Bell. Kerry Buck was to be sterilized because she was so-called feeble-minded. And this was because she had become pregnant, probably from being raped by the nephew of the family she was living with. Her mother had been institutionalized, apparently for an intellectual disability, and her newborn baby was judged to be feeble-minded as well. So it was Kerry, her mother, and her baby who were the three generations in the famous quote in the last line. But I highlighted the sentence before that line as well, because it shows how this forcible US policy of forcible sterilization was framed entirely in public health terms on the idea of preventing genetically ill people from harming society. So when Hitler comes to power in early 1933, one of the first major laws passed is the Law for the Prevention of Progeny with Hereditary Diseases. This orders the forcible sterilization of people with certain afflictions. This law is based entirely on Harry Laughlin's model law in the US. Similar due process provisions, similar list of conditions, but it was pursued even more aggressively in Germany. Over about 70 years in the US, health professionals would forcibly sterilize about 70,000 people. The Nazis would legally sterilize 400,000 people in just a few years, and in a much smaller country. By the way, this does not include people who were illegally sterilized, like in the experiments in the camps. Many were sterilized under this category of feeble-mindedness, because this is a vague, elastic category, which allows you to sterilize homeless people and truants, petty criminals, women who become pregnant outside of marriage, or other socially marginalized people. And the question is, how does the state find individuals to sterilize with? 400,000 people is a lot of people. And for finding people, they largely relied on health professionals who were, in this law, required to report their patients who had these conditions. There were also denunciations by neighbors and employers and even family members, but mostly it was health professionals turning in their patients. And what happened once a proposal to sterilize an individual was received is that it went before a hereditary health court, which comprised 2 physicians and 1 judge. Similar to the due process provisions developed for US laws. And by 1936, Germany had established over 250 of these hereditary health courts across Germany, operating in parallel with the regular German judicial system. So if the decision was for sterilization, the person had 4 weeks to appeal. Otherwise, the sterilization would take place within 2 weeks, and it would take place even if force was required. Now, I want to say, by the way, these were not primarily Jewish people being sterilized. They were ethnically German generally, but they were thought to pose a threat to the health of the German stock. So the Germans knew they were not alone in pursuing this type of program. This is a propaganda poster at the time that says, "We are not alone." And it shows the flags of other countries that have forcible sterilization programs already underway. But let me ask this in this storyline here. What is the next step on this path? If you think genetically inferior children should not be born, what should you do when a genetically inferior baby is born anyways? Karl Brnte was the chief defendant at the Nuremberg trial. He was Hitler's personal physician, and his words at the trial should be taken with a giant grain of salt. He lied a lot. But he described a baby born to a family named Nauer in the winter of 1938 or 39 in Leipzig. The child was apparently blind, missing 1 leg and part of an arm, and as Brnte put it, was an idiot, or at least it seemed to be. The Nauers reportedly petitioned to Hitler to allow a mercy killing of the baby. And basically, Brnte agreed the child should be killed, but he thought it would be cruel to leave that decision to parents, and that doctors and the state should make the decision instead. So the first mass murder program of the Nazis was called the Child Euthanasia Program. It preceded the Final Solution, or Shoah, by 2 years. And I've put euthanasia in quotes here because this was not a euthanasia program. These children and their parents were not seeking a gentle death. It was a cynical, secret, illegal program of mass murder. By August of 1939, just before Germany invaded Poland, which began the war, all physicians, nurses, and midwives were required to report newborn infants and children under the age of 3 who showed signs of serious mental or physical disability. The parents of the selected children would then receive a letter asking that they send their child to a special treatment center. When the children arrived, they would typically be starved to death or overdosed or sometimes killed with an injection of phenol to the heart. But that's not what the parents were told. They were told first the child was doing well, then that he had taken a turn for the worse, maybe had developed pneumonia, and then that the child had died. So this was to camouflage this secret program because it was illegal under German law. The program gradually expands from infants and toddlers to juveniles up to 17 years of age. And conservative estimates are at least 5,000 children with disabilities were murdered by nurses and doctors at around 35 of these specially designated children's killing wards around Germany. The last was actually killed several weeks after the war had ended. And the next step seems obvious. If you are killing babies with disabilities, what about institutionalized adults with disabilities? By 1940, an adult killing operation was developed, codenamed Operation T4, Axiom T4, after the street address of its central office in Berlin's Tiergartenstrasse 4. The T4 program used practices that had been developed in the child euthanasia program. A questionnaire went out to all public health officials, to public and private hospitals, to mental institutions, to nursing homes. It looked like that form was to gather statistical data about which residents were able to work. There were doctors who purposely exaggerated their patient's condition, thinking it might keep them from a work camp. Instead, of course, it marked them for death. These forms were reviewed by 3 specially appointed physicians, many highly reputed physicians, and people selected for this so-called euthanasia were then confirmed by a central administrative medical commission in Berlin. They were then transported to one of 6 killing centers throughout Germany and Austria. On arrival, the patients would be led into a specially designed gas chamber, designed to look like a shower. They would be gassed to death, their dental gold would be removed, and their bodies would be cremated in specially designed crematory ovens. And if this sounds familiar to you, of course it should, because the technologies later used at mass killing centers like Auschwitz, and some of the crematory technologies, as well as the camouflage techniques that could get someone to walk right into the gas chamber, these were developed and perfected in the T4 program. This program was also secret. It was also illegal. Official records were always falsified to indicate the victims had died, usually of pneumonia, but it quickly became an open secret. Articles were written about this in the US. Ashes with hair in it would cover these towns. And some religious leaders in Germany started speaking out against the mass murder of the disabled. And we're now in the war years. Hitler's a dictator, he's running a terror state, but he still cares about public opinion. So in 1941, August, he personally gives orders to halt the T4 program. But the T4 program didn't go away. After this pause, it re-entered a new phase. Some people call this the wild killing phase, which was diffused across Germany. So it was still largely choreographed centrally in Berlin at the T4 office, but local authorities now got to determine the pace of the killing. And instead of using these gas chambers, they used drug overdoses and lethal injections, like in the child program, because that was more covert. Killings now would take place at hospitals all over Germany. Doctors and nurses would have patients they tried to heal, but at the same time, sometimes in the same ward, they would mark other patients for death overnight. By the end of the war, about 200,000 people in institutional settings were murdered in Operation T4. But during this euthanasia pause, another important thing happened. About 100 people were out of work. And these were people who had proven reliable in running an illegal killing program. They were inured to the killing process. They had medical and technical expertise in mass killing. Some of the T4 operatives had already been sent to concentration and labor camps earlier in 1941 to set up a T4 type program there called Action 14F13, which was to murder camp inmates who were no longer able to work. And some T4 operatives were like Johann Neumann in these images, which were only recently uncovered. He worked first in the T4 program, but then was transferred to help build and run a new set of camps oriented entirely around killing, the mass factories for death at Belzec, Sobibor, and Treblinka. Another was Dr. Imfried Eberl, a T4 operative who would become the first commandant at Treblinka. 900,000 Jews were murdered at Treblinka. So the forcible sterilization program, then the killing programs targeting disabled children and then adults are directly connected to the factories for mass killing of the Holocaust. They're connected by ideology, of course, by theories of race and eugenics, but they're also connected by the direct transfer of technology and medical personnel. All were grounded in this racist ideology. Many important policy ideas were borrowed from the US and from other countries. These were all framed as essentially public health programs with the aim of using science to create a master race. So let's back up for a moment and try to understand the pre-war German medical community a bit better. And first, I want to talk about medical ethics, because given what it became, one might assume that German medicine before the Third Reich was in the dark ages ethically. But one of the great ironies of the Nuremberg doctors' trial is that at the time, in 1946, the prosecuting attorneys went looking for national or international standards for conducting research on human beings. They found only 2 formal ethical guides in the entire Western world that dealt explicitly with human subjects research, and both were German. In the 1890s, a Prussian physician named Neisser, some of you will recognize that name as the namesake of Neisseria gonorrhea. Neisser intentionally infected orphans and prostitutes with syphilis to test out treatments. The public learned of this and was outraged, and the Prussian minister drew up ethical guidelines for research. And then in 1931, the German Minister of the Interior issued detailed guidance for researchers across the Weimar Republic. Those Reich guidelines were very detailed. They differentiated between therapeutic and non-therapeutic experimentation, for example. They included something like what we would today call an IRB. And they required the unambiguous consent of subjects of human research, with written documentation required, actually. Medically, scientifically, pre-Nazi Germany was more advanced than the rest of the world. Following the Flexner Report in the US, the German model of clinical medical education had become a worldwide standard. As just one example of their dominance, in the 10 years before the war, Germans and Austrians won 6 of the 10 Nobel Prizes awarded in physiology or medicine, and including one prize that was split between a German and a UK scientist. But German medicine of the time was incredibly inventive and cutting edge. They invented the electron microscope shown here. This is the Siemens electron microscope, which was used to identify asbestos particles in lung tumors. So Germany was also cutting edge in terms of epidemiology. For example, this shows one of the first large-scale surveillance projects charting the incidence of different cancers among smokers and non-smokers, showing a massive difference in sex-related cancers because women were so much less likely to be smokers. They coined the term passive smoking because Germans recognized this as a health hazard. The Germans promoted mass screenings for cancer and other diseases. This is an ad from around 1936, instructing women in breast self-examination. This was decades in advance of similar public awareness campaigns in the US. They urged women to avoid alcohol and tobacco during pregnancy, again, far in advance of similar type public health measures in many other countries. They barred smoking in public spaces, including in party offices and waiting rooms. And I just call your attention to the African-looking head on the cigar, which is there because Nazi anti-tobacco activists said smoking was a vice of degenerates. I'm using the word degenerate intentionally because it includes this notion of genetic, right, inferiority. So the pre-Nazi German medical profession was not backward ethically or scientifically or in public health. In fact, if anything, what set the profession up for its fall might have been its tremendous successes, its pride, its hubris. German physicians become convinced that medical science and public health can help them to create a master race. And the idea here is that of, the simple eugenics we talked about earlier. If a state wants a more fit population, it has to do two things. It has to work to improve the health of the existing population, those deemed fit and worthy, but it also should eliminate from the population those deemed unfit, which of course opens the question, how does the state determine who is unfit? And the answer is they turn to healthcare. So German medical professionals developed these elaborate genetic and racial maps of diseases with two purposes: to promote healthy breeding of a pure race and to eliminate undesirables. So this marriage counseling map shows how couples would have to visit with a genetic counselor, and so-called good marriages would be supported. Undesirable marriages, including those of so-called mixed races, would not be allowed because they posed a risk to the health of the overall state. And I should say, today we recognize this as ideology, not science, but it was promulgated and it was believed as science at the time. The so-called science of hereditary health was taught in all German public schools. After 1933, all doctors received supplemental training on heredity and race. This is an image from a high school biology textbook, but I want to note that it doesn't have much to do with biology, right? Instead, this is really promoting the ideology of eugenic cleansing through an appeal to national resource concerns. So this idea of looking at ill people as useless eaters, as unworthy of life, right? And as costly to the state. This is very important politically, but I want to make a slightly different point, which is it also brought physicians to conceive of the German body, the German state, as a body politic, literally, right? A body that could be ill as a result of an impure genetic pool. This version of Germany, with its racist underpinnings, was the step that led to the final solution. This is an image from 1935, well before the war, and it really illustrates this step. It says, Adolf Hitler, doctor of the German people. And under this ideology of racial hygiene, Jews would be described as cancers or a bacillus, an infection to be eradicated from the German body. The Nazis actually called their racist political beliefs applied biology. Dr. Ernst Rudin in 1933 said German doctors were to be responsible for, and I'm quoting here, preservation of the healthy hereditary elements and eradication of the pathologic elements in society. After the war, when Nazi doctor Fritz Klein was asked by another physician, have you, as a doctor, no respect for human life? He said, out of respect for human life, I would remove a purulent appendix from a diseased body. The Jews are the purulent appendix in the body of Europe. Hitler adopted this in this early speech before the National Socialist Physicians League. He argued that he could do without lawyers or engineers or builders. But if he didn't have the cooperation of people in healthcare, he would fail. So we asked at the outset, how do healers become killers? And one answer is they are transformed into a group in pursuit of national goals rather than protectors of their most vulnerable patients. And I keep coming back to hammer on this. These are perverted and racist national goals, but they are cloaked in science and public health, and medical professionals of all types endorse them with very little dissent. In short order, about half the physicians in Germany voluntarily became Nazis. This is a far higher rate than other professional groups like lawyers or engineers. And it wasn't just physicians. Nurses, dentists, pharmacists, neuroscientists, psychologists often were Nazis. I saw a paper recently that said 62% of maxillofacial surgeons joined the Nazi Party. Many of the defendants at the post-war Hadamar trial, this is a T4 trial, were nurses. They're on the upper left there. Dentists removed the dental gold from Nazi victims. There were at least 48 of them tried for this after the war. Pharmacists, of course, developed and deployed drugs in service to the regime. So why is this? Why such broad participation among health professionals? A lot of reasons have been given for this. All of them probably hold some degree of truth. There was this belief in eugenics. There was also a desire among health professionals to be national heroes, right? To help create this master race, to raise Germany up. Germany, remember, had been defeated in World War I. There was economic damage that followed. There was an oversupply. There were actually unemployed doctors at this time. There were Jewish clinicians and Jewish scientists who held plum jobs that became open when they were eliminated from their career paths. The power of nurses and midwives rose under the Nazis. Midwives were apparently paid per capita for turning in infants with disabilities. And there was the takeover of the independent German professional associations by the state. So in October of 1933, and again, this is 5 years before the war, JAMA reports that a German federal chamber of physicians was being formed. It took place of all the prior independent physician associations. They eliminated all the Jewish people from leadership. And there was very little protest of this around the world. By 1938, the German medical practice laws had been amended, and they read as follows, I'm quoting again, "It is the duty of the medical profession as a group to preserve and promote the nation's health, sound heredity, and racial purity." A warning, I'm going to show you a disturbing image next, and I'm going to use it to make the point that the imagery and language of medicalized killing was a key part of the Nazi program, and especially so in the extermination camps. And for an example of this, I want to speak for a moment about the killing pit at Treblinka. This is not a photo from Treblinka. None are known to exist, but it represents a typical execution pit. Treblinka was the extermination camp built to kill the Jews of Warsaw. It was built in a rural area. It had a reception space where the cattle cars were unloaded. And the reception space resembled a legitimate train station. It had clocks and timetables and posters. It even had a door to a so-called infirmary with a red cross over the door. In fact, this infirmary was a sinister facade. It disguised the entrance to an execution pit, which was used to murder prisoners who were too weak to march to the gas chambers. Prison records actually show how medicalized terms described killing. The patient was cured with one pill, meant killed with a single shot to the head. From this level of medical involvement in killing, it is not hard to see medical personnel administering the final solution of mass death by gassing at other extermination centers. Like here, the sort of quintessential image of the role of medical professionals at Auschwitz is ramp duty. medical personnel, physicians, but also dentists, pharmacists, had ramp duty on rotation, during which they selected those destined for the gas chambers and those healthy enough for forced labor or other cruelties. And of course, because the gas was dangerous, physicians supervised the administration of Zyklon B in the gas chambers. There is, I should say, no record of any physician being punished for refusing to perform ramp duty or any other duty at the concentration camps, but very few refused. Men like Dr. Hans Munch were remarkable exceptions. So it's become common to say the Nazis viewed Jews and some others as subhuman like animals. But these next two images, they're cartoons, and yet I think in some ways they are the most disturbing images I'm going to show you, because they show how this was not the case. It was actually far worse, because it was based in notions from medicine and public health. So first, you might be surprised to hear one of the first proclamations of the Third Reich was to bar vivisection of lab animals. This poster says Heil Göring, vivisection forbidden. And it has the lab animals of Germany saluting Hermann Göring, because in August of 1933, he announced an end to the, quote, unbearable torture and suffering in animal experiments, and said he would commit to a concentration camp, quote, those who still think they can treat animals as inanimate property. So given the treatment of Jewish people and other groups by the Nazis, one must wonder, what were the Jews that they could be considered even less worthy of respect than lab animals? And here is the answer. The title reads, Infectious Germs. The symbols are those for Jews, homosexuals, communists. The scientific gaze of the microscope here looks down on the petri dish of society, completing the biological state metaphor. People have become pathogens. Let me return to the present day and to obligations of remembrance. Here you say curator at the Memorial Museum in DC, preserving memories. In this case, shoes, in an exhibit that brings the reality of genocide closer to the viewers, most of whom, like me, have no familial direct connection to these events. What is our obligation of remembrance? And I realize we're running late on time, so I'm going to go very quickly here to say that the typical contemporary implication people talk about is research on human beings, but I'll point out that it was not until during the trial that Dr. Andrew McAfee returned to the AMA in December of 1946 and said, we need standards on human subjects research, and created these very brief standards. As a consequence, we had to wait. The trial at Nuremberg did not affect immediately the conduct of human subjects research in other countries. It was instead revelations of research abuses like Willowbrook or Tuskegee before we created ethical rules for the conduct of research that are taken seriously today. But really, the fact that we could not learn from the Nazis was demonstrated in the fact that we could not change our human subjects research standards until we had our own reasons to do so. I'll just show you a few of the complex challenges that this history illuminates but does not answer. Issues of conflicting loyalties, issues of the proper balance of skepticism and science when looking at an issue like eugenics that has such intuitive appeal but ends up being wrong. And I'm going to just skip through this. Issues of empathy and professional distance. How do we train people into our profession without them becoming inured to human suffering? Obviously, the Nazi example is the most extreme possible version of becoming inured to human suffering as health professionals. But it is a challenge for all of us not to become a bit hardened by the experience of becoming a health professional. How do we regulate our professions? How do we summon the fortitude to sanction our members who breach our ethical standards, which we largely failed to do in the wake of the war? And I will say, this is not to say professional medical associations are not incredibly useful. I am a strong believer in the importance of professional societies, but to say that professional self-regulation is a major challenge and one that we have to take seriously. So I'll close on this slide, which is to return to where I started, saying that there are deep obstacles to honest reflection and learning about this history and from this history, because it is so painful. The story we've heard today was a shame for our entire profession. And we must never forget it, which it would be easy to do if we think of the Nazi doctors as simply monsters. In the end, the question we face is not how did a few Nazi monsters arise and infect our midst. It's how did most health professionals in the most advanced nation in the world at the time become murderers together, and not despite their training, but in the name of science and public health. I know I ran longer than I had hoped. I actually cut some of this talk and still ended up running long.
Okay, thank you so much, Dr. Wynia. So we will we'll have time for just a few questions, and then we'll take a short break and we'll reconvene for the panel. So we have quite a few people on. We had over 430, so we can't get to all of them. I'm going to try to summarize some of the most common ones. So one that came up in a lot of different forums today and in the questions submitted in advance is, are there lessons of the Holocaust that may be relevant to events over the past several years, particularly with health policy and health practice related to the pandemic?
Yeah, I mean, with respect to learning direct lessons, I'll return to what I started with, which is there is nothing going on today that is comparable to what we saw during the Holocaust. And yet, I think the light that is cast by this history can illuminate some of the core challenges, right? So issues of making determinations in times of crisis about where our ethics lie and about who is valuable and who is less valuable in society, right? So we've spent an enormous amount of time and energy thinking about crisis standards of care and triage protocols. This conversation has been inevitably colored by concerns that we not build a triage protocol that inadvertently disadvantages people who live with a disability, for example, or who are older, right? And yet we also have real concerns that we not use resources in ways that do not help. So we need to use our resources in ways that are productive, that are that are efficient uses of very limited resources, things like monoclonal antibodies right now, which are in tremendously short supply. How do we ensure that we get those into the people who are most likely to end up in a hospital, who are most likely to end up having to take up a bed, which someone else with a heart attack might need, right? All of those conversations are colored by our awareness of this history. And there are many other ways, but I'll stop there.
Yeah. Another question is, and this is something that comes up a lot, what are the ethical ramifications of using or citing research from the Nazi era and the camps?
Yeah, I would say, Malia, that may be the most common question we get after giving this talk is this question about whether it's okay ever to use the data. And I will say, first of all, there was for a long time a sort of naive hope or belief that most of the data collected by Nazi doctors in these unethical experiments were bad data, which they are, but also bad in the sense of unreliable or invalid, because these bad people must have also been bad scientists. They must have been bad researchers. And that is not, unfortunately, always the case. Some Nazi scientists and researchers were undoubtedly bad at their job, as well as becoming evil people. But some of them were famous people who, have went on to have diseases named after them, right? There's a reason why we have ongoing conversations about whether to keep the names of diseases that are named after doctors with a Nazi past. Many of the leading lights of Nazi Germany in terms of the medical profession became Nazis. So they were not the scum of the Nazi medical profession. Some of them were leading figures, and their research did produce results that can be used. And the question is, should it be? And I will say there is dispute about this, even within the community of people who are the victims of this research. So the twins, some of them thought that, if you don't use this knowledge gained, which hopefully will never be, those experiments will never happen again, then you're wasting the lives of the people who died in pursuit of that knowledge, even if they were killed, by others. And there are others who say, if you die, it gives legitimacy to the use of the research. And so it should never be cited. It should be thrown away, burned, and destroyed. The way that the profession has sort of come to consensus around this is that if there is an aspect of this research that is unique and uniquely valuable and cannot be cited in any other way through reference to any other source, then it can be cited, but it ought to be cited in the body of the paper, not just as a footnote. And it should be included that you are citing this for the following reasons, and you recognize the unethical way in which these data were obtained. So that's been the sort of consensus, although I would still say that is a continuing area of contention.
Yeah, our next question comes from a second-generation survivor, and she's curious about Jewish doctors during this time, who they were, and what struggles did they have? What did they try to do to save themselves?
Yeah, and I do so think, what I've talked about here is less than half of this story. The other half that I really think every health professional student should be exposed to are the stories of Jewish health professionals and others who under circumstances of incredible stress and uncertainty and danger performed often heroically, and really evinced the very best of what there is in our profession. I told the story of how healers become killers, but there is another large set of stories to be told about how medical professionals sustain and retain and even enhance their professionalism and their professional ethics in spite of enormous stresses. There were Jewish health professionals who ran a medical school in the Warsaw Ghetto, an illegal medical school where about 500 students actually participated in taking classes. Only about 12 of those students actually survived the war, but they were given credit for the courses they took, and they were allowed to continue in the medical programs outside of Warsaw afterwards. There were medical professionals also in the ghettos who realized that everyone around them and they themselves would soon be dead from starvation. And so they started taking records of their own physiology. They started collecting lab data on themselves and on their patients to document the process of human starvation. And that hunger study is still a valuable resource for people who take care of patients who are starving to death, like people with anorexia nervosa, for example. Today, obviously, there's much more research beyond that now, but that sort of laid the groundwork for subsequent research on human starvation. And again, they realized this would never, hopefully, ever happen again, that a group of well-trained medical researchers would be in this circumstance. And they tried to make the best of it that they could by collecting data on themselves and smuggling those data out of the ghetto. There are many, many more stories. And really that we have done that we've done that as the focus of our program in prior years. And I think, that undoubtedly we will do future programs on those stories as well.
Okay, and final question for this part of the program. There are a lot of people who have been in this field for a while, but also some that are trying to learn more. If you could only recommend one or two books, articles, or resources on the role of Nazi health professionals in medical ethics, what would they be?
Boy, I mean, I hate to be self-serving, but I will say the special issue of the American Medical Association's Journal of Ethics from January of last year is available for free online. It includes both video, interactive type resources, as well as a number of short, very accessible articles on this history. And then I would say, look at the references in those articles, because you will, in just a few articles, you'll see cited the landmark work that has built this field over the last 70 years, really. I will also say, just in passing, that the Lancet Commission on Medicine in the Holocaust has work ongoing in this domain, and I anticipate next year I might refer you to the report of the Lancet Commission, because I expect that will be out in the next year.